Alright, so hi everyone, a very good morning to all of you and welcome back once again to another class of government schemes. In today's class, we are going to cover another two important schemes from the Ministry of Health and Family Welfare, and the names are Pradhan Mantri Swasthya Suraksha Yojana and the very important National Health Mission. So please give me a thumbs up if you guys can see me properly and can hear me properly, if the audio is fine or not. Good morning, everyone. Good morning, Mukund. Shrishti, please give me a thumbs up if everything is fine, if you can see me properly and can hear me properly, and please tell me whether the audio is clear or not. And if it is not clear today, then अगली class, then I have identified the issue. अगर आज भी okay नहीं होगी, तो I have identified the issue. Then it will be cleared in the next class. आज ट्राई करना था मेरे को कि आवाज ठीक आ रही है कि नहीं आ रही है. जल्दी बताइए if everything is fine or not. चलिए, let's start with the class and let's talk about first of all Pradhan Mantri Swasthya Suraksha Yojana. Now, what is Pradhan Mantri Swasthya Suraksha Yojana? Under this particular scheme, the government intends, the government intends to correct regional imbalances in the availability of affordable and reliable tertiary healthcare services and to augment facilities for quality medical education and research in the country. Too much technical objective, right? Too much technical objective. So let us not learn this particular objective. Let's try and understand that this scheme is for providing high quality tertiary healthcare services to the citizens, number one. And number two, this scheme is for augmenting, for enhancing the quality of medical education in the country. Right? Now, how government is providing the reliable tertiary healthcare services to the people under this scheme, and how the government is improving the quality medical education, and that's all the scheme is all about. So how they are doing it? So they are providing tertiary healthcare services by establishing aims like institutions across the country, and the second objective, that is how it is improving the medical education's quality by improving the quality of government medical colleges, state government medical colleges. ठीक है, तो ये दो तरीके से सरकार अपने इस स्कीम के ऑब्जेक्टिव को फुलफिल करती है. दिस स्कीम वाज लॉन्च्ड इन द ईयर 2003. इट वाज लॉन्च्ड इन द ईयर 2003. ठीक है, चलिए, तो अब ये स्कीम में बस इतना ही है. What government is doing under it? The government is setting up new aims under it, and already 22 aims have been approved to be established. ठीक है, across the country. There were 6 aims: Bhopal, Bhubaneswar, Jodhpur, Patna, Raipur, and Rishikesh. That became operational in 2012, and after that, more aims were approved, and कुछ के ऊपर बहुत सारा काम चल रहा है, कुछ अप्रूव हो चुके हैं. ठीक है. And the second objective is being fulfilled through upgradation of government medical colleges in the country. There were 75 government medical college upgrade projects which were approved under this particular scheme, which included the facilities like super specialty blocks, trauma centers, medical equipment procurement, etc. ठीक है. So this scheme is this only. ठीक है, अगर आपसे if anybody asks you that what Pradhan Mantri Swasthya Suraksha Yojana is all about, then you can simply say that this scheme is all about setting up aims in the country and to upgrade the government medical colleges, thereby improving the medical education. Or the other way around, you should remember this scheme because we know that the government is focusing a lot on establishing aims across the country. ठीक है, almost every month there is a news regarding any particular aims in the newspapers or in the PIB. So you must be aware of this fact that all of these aims are being established across the country under Pradhan Mantri Swasthya Suraksha Yojana. ठीक है, that's something which is very basic that you as an aspirant should know. Now, let's talk about some other features. Cooperative federalism this scheme is promoting, because it is on one hand it is establishing aims across the country, right, and on the other hand The scheme is improving the state government medical colleges. ठीक है. It provides comprehensive healthcare coverage because it aligns with other schemes like Ayushman Bharat, Jan Aushadhi Pariyojana. ठीक है. It is focused on research and education, obviously, because it is talking about improving the medical education. And once we are talking about improving the medical education, we will talk about the medical education as a whole, which includes research as well, right? And it talks about modern medical facilities. Obviously, my dear friends, the healthcare access can only be improved. Yeah, the medical education can only be improved if we have the modern medical facilities. So the scheme is focused on all these areas. Okay, I hope it is clear. The scheme is done. Okay, the scheme is done. There is no other provision that we have to cover under this particular scheme. इसमें से question आया तो या तो launch year का होगा या फिर यही होगा that under which scheme the government is establishing aims across the country. In that case, the answer would be प्रधानमंत्री स्वास्थ्य सुरक्षा योजना. ठीक है कि नहीं ठीक है? Now, impact and outcomes are very easy to understand. Aims operationalization, 22 aims have been approved with significant progress in 16 aims in terms of classes and healthcare services. Now, this data you need to again revisit, not again revisit, ये तो गलत हो गया. You need to revisit this data just before your examination that how many aims are still there in the country, are operational in the country. Enhanced medical education, because once we are focusing on improving, on upgrading the medical colleges, it will obviously lead to the improvement in the medical education. Improved healthcare access. अब एम्स बनेगा सारे जगहों पे तो healthcare access को improvement मिलेगा ही. And it talks about holistic development because it is a collaboration between the central government and the state governments. ठीक है. I hope the scheme is clear. If yes, my dear friends, please give me a thumbs up. और मैं देख रहा हूँ बहुत कम लोग क्लासेस ये वाली लेते हैं यार, कुछ करो, ऐसे नहीं चलेगा भाई. चलो. Okay, if the scheme is clear, please give me a thumbs up. Then we'll start the next scheme, that is the National Health Mission. Now this scheme is again very important. ठीक है, ये स्कीम भी बहुत ज्यादा इंपॉर्टेंट है, आपको पता होना चाहिए, मुझे आपको बताने की जरूरत नहीं पड़नी चाहिए. जल्दी से बताइए. Okay, let's move ahead to the National Health Mission. Now, yeah, I don't think that I should explain the objective of this particular scheme. National Health Mission. Obviously, we must be talking about the affordable, the equitable, the quality healthcare access to all the individuals of the country, right? It is an umbrella mission, right? Where the government is catering, where the government has the intention of providing equitable, affordable, and quality healthcare access to all its citizens, right? And that is the objective of this particular scheme. And obviously the universal health coverage is also one of the objective to achieve universal access to equitable, affordable, and quality healthcare services that are responsive to the needs of all individuals, particularly the unserved and vulnerable population. Dekho, all the welfare schemes, do remember that if anybody asks you what is the focus area, all the welfare schemes. So all the welfare schemes, my dear friends, the focus targets, the focus the targeted beneficiaries will obviously be underserved and the vulnerable population. Because if I talk about the National Health Mission, it talks about equitable, affordable, and quality healthcare services. So the people who are rich, or are privileged, they can easily have the access to quality healthcare services because they have money, they have resources, right? Who lags behind is the people who have no resources or less resources, or who are underserved or unserved or vulnerable. ठीक है ना? So all the welfare schemes are majorly focused on the vulnerable population and the underserved and unserved population, right? This scheme was launched in the year 2013 by subsuming the National Urban Health Mission and National Rural Health Mission. ठीक है जी. तो नेशनल हेल्थ मिशन का ऑब्जेक्टिव आई होप क्लियर है. आगे चलते हैं. व्हाट इज द एलिजिबिलिटी क्राइटेरिया? देयर इज नो सच एलिजिबिलिटी क्राइटेरिया. दिस स्कीम इज यूनिवर्सल एंड इट इज अवेलेबल टू ऑल सिटीजंस, बट एज आई ऑलरेडी टोल्ड यू, द मेजर फोकस विल बी ऑन द अनसर्व्ड, अंडरसर्व्ड एंड द वल्नरेबल पॉपुलेशन. ठीक है, विमेन, चिल्ड्रन, इन सब के ऊपर फोकस होगा. So as it is mentioned here, special emphasis will be on the rural, urban, poor and tribal populations. ठीक है. Women and children under programs like Janani Shishu Suraksha Karyakram are also the targeted group. Vulnerable groups, ST, SC, other economically weaker sections. So yeah, basically the people who cannot afford the quality healthcare services will always be the targeted area, will always be the focused area, right? Now, what are the components? There are five components of National Health Mission, okay, through which the entire healthcare ecosystem is being strengthened. ठीक है, number one, health systems strengthening. अब हेल्थ सिस्टम स्ट्रेंथनिंग में क्या क्या चीजें आती हैं, what all it include. So upgraded infrastructure, ठीक है, that is something which is very important. Human resources, the medical officers, the staff, the doctors, drugs, equipments, ambulances, and mobile medical units. All of these have to be strengthened because these form the basis of any medical ecosystem. भाई जब हॉस्पिटल की दीवारें या हॉस्पिटल का इंफ्रास्ट्रक्चर ही अच्छा नहीं होगा, how can that hospital is expected to provide a good treatment? If the proper drugs, if the proper equipments, the medicines are not available, if the number of required staff is not available, then how can you expect that that particular hospital or the healthcare center can provide good treatment? Okay, so number one is health system strengthening. Number two is RMNCH plus A, that is reproductive, maternal, newborn, child, and adolescent health. Under this particular component, the National Health Mission provides comprehensive care for women and children. Okay. Then we have communication disease control. It targets certain communicable disease like malaria, dengue, kala azar, leprosy. Okay. NCD control, that is non-communicable disease control. Diseases like diabetes, high बीपी, कॉमन कैंसर्स, ठीक है, इन सबको एड्रेस करता है. देन इंफ्रास्ट्रक्चर को मेंटेन तो करना है, ठीक है. मेंटेन में सैलरीज ऑफ हेल्थ केयर वर्कर्स लाइक एएनएम्स एंड एलएचवीज ये सब भी आ जाता है, ठीक है. इंफ्रास्ट्रक्चर बना तो दिया पहले वाले कंपोनेंट में, हेल्थ सिस्टम स्ट्रेंथनिंग में, बट उसको मेंटेन भी तो करना है. एंड फॉर मेंटेनेंस अगेन इट रिक्वायर्स अ कॉस्ट, ठीक है. चलिए, तो ये थे पांच कंपोनेंट. इन पांचों कंपोनेंट का एटलीस्ट आपको नाम याद रखना है, राइट. Now, let's talk about the targets. This you have to remember, guys. और बहुत सारे तो आपको पता भी होंगे already, but you have to remember. And very recently, not actually very recently, I believe in the year 22 or 23 maybe, this National Health Mission, the targets were extended to be achieved by the end of financial year 2026. यानी कि by the end of this financial year, the targets under National Health Mission have to be achieved. So what are the targets? Reduce MMR to 87 from 113, which is currently 93 as per the recently released SRA, Sample Registration Service survey for the period of 2019 to 21. This survey, guys, I am going to cover in today's PIB session. Don't worry, ठीक है, आपको चिंता करने की जरूरत नहीं है. सैंपल रजिस्ट्रेशन सर्वे आया है अभी 2019 से 21 पीरियड का. आई विल बी कवरिंग इट टुडे, ठीक है, at 5 p.m. in my PIB session. Reduce IMR to 22 from 32. It now stands at 27 according to this survey only. Reduce under 5 MR to 23 from 36, which is currently 31. ठीक है, again as per SRS. ठीक है. Sustain TFR to 2.0. We have already achieved the fertility level of 2.0. Now we have to sustain it. Achieve the operationalization of 1.5 lakh Ayushman Bharat Health and Wellness Center, which are now Ayushman Arogya Mandirs. Yes, these are already under operation. In fact, around 1,70,000 Ayushman Arogya Mandirs are there. Then reduce prevalence of leprosy to less than 1 per 10,000 population and incidence to 0 in all districts. I think we have achieved this target as well. Annual malaria incidence to be less than 1 per 1,000. Prevent and reduce mortality and morbidity from communicable and non-communicable injuries and emerging diseases. Reduce household out-of-pocket expenditure on total healthcare expenditure and ending the TB pandemic by 2025 in the country. Obviously, अब ये तो as an epidemic it is not there, but TB is there. TB is there, so we can't say that we have achieved this target. And ये obviously target जो expand होगा ही होगा. अभी 2025 हमारा already running है, so I can't, I can't see the possibilities of eliminating the TB epidemic by the end of this year. Right? That's all about National Health Mission as well. You need to remember these targets. These are very, very important. I hope you know. And don't worry, I will be covering the sample registration survey in today's PIB class. Okay, now let's talk about the impact and outcomes of the scheme. First of all, reduction in mortality rates, MMR, IMR, under 5 MR, improved access, enhanced healthcare services for rural and underserved populations, disease prevention and control, reduced prevalence of communicable and non-communicable diseases, and it talks about the financial protection as well because it is focused on reducing the out-of-pocket health expenditure of the citizens. Right. All right, guys, that's all for National Health Mission as well. So it was uh, a quick session for these two schemes. I hope both the schemes are clear. If yes, please give me a thumbs up. If not, you guys can ask me the doubt. If you want to have the PDF of this class, you can join the Telegram channel PIB by Manish Sir. If you are not able to find the channel, you guys can DM me at Mashi Manish. I will provide you the link to the channel. Okay, now please give me a thumbs up if everything is fine. If not, you guys can ask your questions, your queries. And I hope the audio was fine today. There were no disturbances today. And I'll try that there will not be any disturbance in the future as well. I think everything is clear because okay, I'm glad to see that both the schemes are clear to everyone. All right, guys. ठीक है चलिए let's wind it up. I'll see you in today's PIB class at 5 p.m. Till then, keep studying and keep studying hard. Goodbye, take care, and God bless.